So good day everyone, I am Clarence Mili de Jesus together with my groupmate Edward James Polado, Eric Nulles, and Jimmy Nubera, and we are here to discuss the polygraph techniques. But first, we must know what is polygraph examination. Polygraph examination is generally used as an investigative aid or technical aid in the investigative process. It is used to verify if the statement of the victims or complainant, establish the credibility of the witnesses, evaluates the truthfulness of the suspect. It is also used for pre-employment screening and loyalty check of personnel, security risks such as leakage of information and counterintelligence, infraction of criminal law, misconduct, and use in medical measurements. So, polygraph examination has a lot of uses. Sinasabi dito na pwede siya magamit in investigative process, credibility of the witness, and magamit din ito in pre-employment screening. And next is admission and confession. When we say admission, it is statement of fact by the accused which do not directly involve acknowledgement of guilt in committing or having participated in the commission of an offense. While the confession, it is made by a person voluntarily, stating or acknowledging that he has committed or participated in the commission of crime. So, sinasabi dito na ang admission is nag-i-state ka ng fact pero hindi mo ina-acknowledge yung guilt. While the confession dito, mismo inaamin mo na ikaw yung nag-commit ng crime or ginawa mo talaga isang bagay. So, let's give us an example. Halimbawa, ako ang suspect. Sasabihin ko na, oo, kinuha ko yan, pero iniwan niya kasi dyan. So, it is a kind of admission. Nag-state siya ng fact, pero hindi niya directly inaamin na nag-commit siya ng crime or siya talaga yung may gawa. While the confession, inaamin niya mismo na, oo, ako ang may gawa niya. Ako ang kumuha niyan. So, that's the difference between admission and confession. So, next is the physiological phenomena as basis of detecting deception as per the Tripod Foundation. Meron tayong tatlo. First is the blood pressure and heartbeat frequency, breathing as means of detecting deception, and lastly is the electrodermal response. Blood pressure and heartbeat frequency. Increase of blood pressure and heartbeat frequency following relevant questions, and the suppression in breathing are the criteria for detecting deception. In curves as shown on the heartbeat recorded on a moving graph paper of polygraph represent the beat frequency or the pulse, and the two pressures, the blood pressure. So, following the relevant question, nag-i-increase po ang ating blood pressure or the heartbeat frequency. So, yun ay nagkakaroon ng result in our polygraph machine and in curves as shown on the heartbeat recorded on moving graph paper. So, may kita yun sa moving graph paper na nagbabago ang ating breathing and blood pressure and also the heartbeat. So, systolic or high pressure, they exist when the heart is contracted and the valves are open with the blood rushing into the arteries. SHC stands for S for systolic, H for high pressure, and C for contracted or heart is contracted. While the diastolic or low pressure, they exist when the valves are closed and the heart is relaxed. DLR stands for diastolic, L for low pressure, and R is relaxed or heart is relaxed. So, sinasabi natin na ang systolic or high pressure, may kita ito in chart drive module. Ito yung pagtaas ng linya. While the diastolic or low pressure, from the word is low, ito yung pababa na linya na may kita in chart drive module. Breathing as means of detecting deception. Inspiration or inhalation, it is contraction of the diaphragm and expansion of the chest cavity, those result in the air rushing into the lungs. While the expiration or exhalation, relaxation of diaphragm and the contraction of the chest cavity, those result in the air rushing out of the lungs. So, when we inhale, diba? Inhale, so nagko-contract ang diaphragm while nag-e-expand ang ating chest and yung air is pumapasok sa ating lungs. When we exhale, nagre-relax ang ating diaphragm while the chest is nagko-contract and the air is rushing out of the lungs. And that's the breathing as means of detecting deception dahil madadetect natin doon ang deception ng isang tao by means of breathing. So, this is the following affects the breathing rates. First is muscular exercise, anticipation of muscular exercise, recalling mentally emotional experience, mental activity, anxious expectancy, shock, and surprise. So next is electrodermal response. It is the most current popular name for human body phenomena in which the body, mainly the skin, changes resistance electrically upon the application of certain stimuli. It consists of two categories, normal response and abnormal response. So, the polygraph technique is accurate. The polygraph is the most accurate tool available today for determining the truth or deception. The accuracy rate is between 95 and 98%. This percentage is still the higher than the other forms of evidence, including psychiatric opinions, suspect identification as provided by the victims and witnesses, and fingerprint identification. So, polygraph techniques is the most accurate tool that we have today, that it has a 95 to 98% of accuracy rate. And the factors that affects the accuracy of the polygraph results are the instrument, the condition of the suspect, the condition of the examination room, and the qualification and skill of the examiner. Specifically, the 15% errors in lie detection tests come from the following: nervousness or extreme emotional tension, physiological abnormalities, mental abnormalities, unresponsive in a lying or guilty subject, attempt to beat the machine by controlled breathing or muscular flexing, and unobserved application of muscular pressure. Barriers to the polygraph examination. So, ito yung mga maaaring humadlang in the polygraph examinations. First is the pathological liars. So, ito yung mga taong magagaling na magsinungaling. Mental cases, person under the influence of intoxicating liquor, o yung mga taong under the influence of drugs or lasing. Narcotics-related cases, such as under the influence of drugs, and various heart and other organic troubles. Next is the different types of polygraph machine. First is the Lafayette computerized polygraph. Second is the Ambassador or Lafayette polygraph and the Stowell-Ting polygraph. The physiological changes within the examinee's body are monitored by the following polygraph attachments. So, ito yung mga bagay or mga physiological changes na namomonitor ng polygraph machine, such as respiratory rate, blood pressure or heart rate, and the galvanic skin resistance. Respiratory rate. Two rubber tubes filled with air called pneumographs are placed around the examinee's chest and abdomen. When the chest or abdominal muscle expand, the air inside the tubes is displaced. So, meron nilalagay in polygraph machine. Later is may picture tayo dyan. Meron nilalagay dito in chest and in abdominal. So, yung tubes na yun is naglalaman ng air. And when we have physiological changes, so nagbabago, nadi-displace yung air sa loob ng pneumograph ay ng pneumotubes, then it may have result in our polygraph machine. So next is blood pressure or heart rate is placed around the examinee's upper arm. Tubing runs from the cuff to the polygraph. So in our right hand, meron nilalagay dito, that's the cuffs. Ang tawag dito ay cuffs. So later din is may picture tayo, and it will detect the changes in blood pressure or heart rate. So, the cuffs is connected in our polygraph machine. Galvanic skin resistance. This is also called electrodermal activity and is basically a measure of sweat on the subject's fingerprint. Finger electrodes are attached to the two of the examiner's fingers. These electrodes measure the skin ability to conduct electricity. So, kung ang blood pressure cuffs natin is nasa kanan, ang finger electrodes naman natin ay nasa kaliwa, pero in finger. So, nilalagay ito in index finger and in ring finger. So, ang dalawang daliri na to ang pinaglalagyan ng electrode. So, ang electrode is na-detect niya ang electricity sa ating daliri by means of sweat or pawis na napoproduce ng ating balat or ng ating daliri. Next is major component of polygraph instrument. So, meron tayong 4. First is pneumograph component, galvanograph component, cardiograph component, and lastly is the chemograph component. Pneumograph components. This component occupies the two upper pens of the instrument which records the thoracic and abdominal. So, meron tayong example dito. And sinasabi dito na two lines upper ang meron sa pneumograph. So, which means itong dalawa. Isa for thoracic or the chest, while the nasa baba is the abdominal. The inhalation and exhalation of the subject causes the tubes to expand and contract, thereby reflecting the changes through billows to the pen into the chart. So, kapag nadi-displace ang pneumotubes in our chest and in our abdominal, so, nagkakaroon ito ng resulta in our polygraph machines, and dito siya nababago. So, every changes is nadedetect ng ating pneumotubes. And this is galvanograph component. This is the longest and the third pen of the instrument. The electrodes are attached to the index finger and the ring finger of the left hand. So, sabi ko kanina na ang electrodes is nakalagay in our left hand but in finger. So, index finger and ring finger. So, sa dalawang daliri na ito, dito nilalagay ang finger electrodes. And sinasabi dito this is the third and the longest. So, dito siya, kung itong dalawa is for thoracic or the chest and the abdominal, ang pangatlo naman is for galvanograph component. Ito yung longest. And the third pen in our polygraph machine. Cardiograph component. This is the fourth and the bottom pen of the instrument. This cardio unit is a mechanically operated unit. This system records the changes in mean blood pressure, rate and strength of pulse by means of medical blood pressure cuff. So, ito siya, the fourth and bottom pen of the instrument. Ito yung last and nadedetect nito is yung blood pressure. So, di ba kanina sinasabi ko na nadedetect ang blood pressure changes by means of cuffs na connected in our polygraph machine. Chemograph component. This is the chart drive recording unit of the instrument. It has a synchronized motor that drives the chart at the rate of 6 to 12 inches per minute. So, ang chemograph component, ito na mismo yung recording unit ng polygraph machine. So, nagre-release ito ng 6 to 12 inches per minute na chart drive module. So, kapag sinabi natin chart drive module, ito na mismo yung papel na ginagamit in our polygraph machine. The detachable part of the polygraph instrument. So, kapag sinabi natin detachable part, ito yung mga natatanggal na part in the polygraph machine, such as finger electrodes, blood pressure cuffs, and the pneumotubes. Next is...
So, what are the built-in accessories of the polygraph instrument? Chemograph or chart driving mechanism, a chart roll arbor, idler roller, pen table paper, guides, sprocket roller, cutting bar off and on power switch, synchronous motor. So, how does a chemograph work? A chemograph consists of a revolving drum wrapped on a paper na kung saan ginuguhit nito ang isang stylus para i-record ang mga nasusukat na mga pangyayari katulad ng motion or pressure. Number 2, pen and inking system. Capillary pen, inkwell plates, ink dropper, and catch bill. Number 3, pneumograph section. Rubber jellos, beaded chain, rubber flexible tubing, pneumograph tube connection, pneumograph connecting tube, pneumograph distributing ink, pneumograph pipeline, vent valve, and vent bottom chamber assembly. What are the necessary considerations for an effective polygraph testing? Number 1, the instrument. Polygraph examination uses the polygraph instruments as the device to use for recording the result. Hence, all its components and accessories must be operational and functional. The examiners should check the sensors, transducers attached to the body of the subject. First, pneumograph tube is fastened on the subject's chest and abdomen through the beaded chain. Blood pressure cuff, the same type used by physician, is fastened on the subject's upper right arm or biceps. Finger electrodes, fastened to the left index and ring fingers of the subject. Pen lifter. Rise or lower pen to 3 positions. Chart drive module. Wrappers chart paper at the rate of 6 to 12 inches per minute, also known as chemograph. Paper tear bar. Provides cutting edge for removal of charts. Mechanical pneumo module. Recording parts of mechanical pneumo channel. Galvanic skin reflex or GSR module. Recording parts of GSR channel. Mechanic cardio module. Recording part of mechanical cardio channel. Chart drive roller lever. Lifts chart drive roller for paper change and chart removal. Sphygmomanometer dial reads operating pressure of cards channel. Pneumo 1. Pneumatic connection for upper thoracic pneumograph. Pneumo 2. Pneumatic connection for lower abdominal pneumograph. Cuff connection for cardio channel subject cuff tubing. Pump connection for hand pump using to inflate subject cuff. Centering control. Position pen on chart rotating clockwise. Raise the pen while counterclockwise rotation lower it. Operates similarly on all channels. Sensitivity control. Determines the tracing size, amplitude. Rotating clockwise increase size while counterclockwise rotation decrease size. GSR mode switch. Select the operating mode for GSR. Channel manual or automatic. GSR input connector. Accept plug from GSR subject attach cord. Cardio lock lever. Immobilize mechanical cardio mechanism when not in use. Vent. Perform venting function of pneumatic system. Number 2. The examiner. Basis to all that has been said with regard to the utilization and accuracy of the polygraph technique is the matter of the examiner qualification and skill. As an examiner must be an intelligent person with reasonable good educational background, preferably college degree. He should have an intense interest in the work itself. No amount of training or experience will overcome lack of this necessary qualification. Number 3. The subject. Generally, there are 3 types of subject for polygraph testing. Number 1. Suspect. Number 2. The victim of the complainant. And number 3. The witness. Specifically, the following can be subjected for polygraph testing. First, subject whose guilt is definite of or reasonable certain, emotional offender, person who commit crimes in the heat of passion, person whose offense are accidentally in nature, non-emotional offender, person who commit crimes for financial gain, subject whose guilt is doubtful or uncertain. A subject for the polygraph testing must be in a good physical and mental condition before he may be submitted for examination. On the other hand, there are group of subjects who cannot be recommended to undergo polygraph testing such as the following. Number 1. Person who have extreme nervousness. Number 2. Person who have psychological abnormalities such as high blood pressure, hypertension, heart disease, respiratory disorder, toothache, severe headache, and practically any painful ailments. Number 3. Person with mental abnormalities. Number 4. Unresponsive person such as those who suffer mental fatigue or under the influence of drugs or alcohol. Number 5. Pregnant woman. Number 6. Person below 18 years of age.
Polygraph examination is importantly considered for effective polygraph testing. The condition of the room must be as follows. Number 1, conduct private room at hindi maingay. Number 2, dapat walang distraction at walang police officer na paikot-ikot or tao inside the examination room. Number 3, a room without any window at all. Number 4, dapat walang window, we avoid distraction. Number 5, a room dapat free for the noise, kaya pinagbabawal ang madaming tao inside the examination room. Number 6, adequate ventilation. Hindi mainit, hindi malamig. Dapat yung sakto lang at comfortable yung room. If practicable, the examination room should be equipped. Dapat naririnig kung ano yung pinag-uusapan, anong uri ng question yung mga tinatanong sa kanya. We permanent person to observe. Since the subject must be conducted under condition of privacy, the police custody can be watched hanggang ini-interview siya, pinapanood siya ng police officer na kung ano yung mga sasabihin niya, pinapanood niya ito. The important reminder for examiner, following must consider. Number 1, do not wait. Number 2, huwag ka masyadong maraming tanong or maraming sinasabi tungkol sa kanya. Yung number 3, do not fail. Aralin mo muna yung kaso bago ka mag-conduct ng questioning. What is usual duration of polygraph testing? Polygraph testing normally takes from 1 to 3 hours. Depende ito sa kondisyon or attitude ng subject na kinakandakan ng examination. Number 2, examination sometimes may be very short due to the confession of subject. Number 3, the actual questioning aspect of examination, which to repeat 3 or 4 times and last no longer than set in some case. What are the procedure followed in polygraph technique? Meron itong primary preparation. This stage is initial interview with investigator handling the case or person questioning it. Number 2, the stage include obtain or evaluation of facts. Unahin natin yung number 1, sworn statement, the suspect, witness, victim, and complaint. The sworn statement, kung voluntary ba siya or hindi siya pinilit. Pagtapos noon, gagawa siya ng yung incident or spot report. Number 3, road sketch or picture of crime scene. Phase 3, the pre-test interview. This is a stage of interview of the subject. The primary purpose of pre-test interview is prepare or condition of the subject for the test. Number 1, una sasabihin mo sa kanya yung mga constitutional rights niya. Pangalawa, sabihin mo sa kanya kung voluntary siya or mag-conduct ng polygraph examination. Number 3, sa pamamagitan ng pagpirma ng statement of consent, determine or evaluation. The following right of the subject must be informed clearly to him or her. Number 1, the right to remain silent. Karapatan niyang manahimik. Ano man sasabihin niya, pwede maging laban para sa kanya. Number 2, anything he or she say must be used in favor against sa kanya. Number 3, the right to have lawyer or his or her own choice. Karapatan niyang kumuha ng abogado or bibigyan siya. Number 4, right to refuse. Karapatan niyang mag-refuse sa polygraph examination.
Phase 3. The examination test. After a pre-test interview, the examiner should proceed the placement or attachment of polygraph sensor. The first to be attached is the cardiopulmonograph and galvanograph sensor. The examiner should have reviewed all the questions with the subject before actual examination is made to discourage any statement by the subject given upon the preliminary preparation, limiting the scope of question the question must. A relevant use in any examination will be confirmed to a single case investigation. A relevant question must ask questions which have no briefing to the case under investigation to have standard control or comparison to the format of the question. Control question, that question irrelevant to the matter investigation but similar to the irrelevant question they ask if there is doubt in the interpretation of the subject response to the irrelevant question. The stimulus test. The examiner they inspect the abstract and ask the subject his or her reaction to the question means they are truth or lie to the question. The examiner improve test validity of a question to have further clarified in the question, and will they continue to the test and obtain 2 or more chart in the same way to have similarity in the answer of the subject. To clarify the findings, to learn any other reason for the subject to respond to the irrelevant question and other knowing of the crime. Obtain additional information and an admission for the enforcement purpose in the result suggests deception.
And this concludes our video presentation. I hope you find it informative. Again, we are Group 2. I am Clarence De Jesus, together with my group mates, Jimmy Nobera, Eric Nulles, and Edward James Bolado. And that's all. Thank you for watching.